The process of lung transplant involves 3 locations: a donor at a donor hospital, a recipient at a recipient hospital, and the 2 could be in same city or different cities, and a government agency, SOTO, ROTO or NOTO, which will coordinate the activity. So typically, a call arises from a donor at donor hospital that lungs are on offer. The details of the donor are put on a message, and all the recipient hospitals get this message. They look at their recipient waiting list, which is registered with the government, and match blood group, height, and the lung volume. And if there is someone who's matching, you put a claim, and then based on the merit list, that is seniority, and the geographical proximity between the donor and recipient hospital, NOTO allots the lungs to a hospital. The recipient hospital team contacts the donor hospital, and the donation time is fixed, and the team reaches there to take the lungs. After due diligence on the table, checking the fitness of the lungs, you accept finally the lungs. You take the lungs out, preserve them, and quickly run back to your hospital. In the meantime, another team here gets the recipient to the hospital, does a quick check, takes him or her to the OT, anesthesia, and the chest is opened, mobilization of the lungs is done, and you are ready for implantation. As soon as the team arrives, the recipient's one lung is taken out, lung is put, other lung is taken out, lung is put, and this process is done under ECMO support. At the end, you gradually wean the ECMO off, and the patient is referred to the ICU on ventilatory support. In short, this is the process of lung transplant.